In this video, we will talk about posterior lead placement. Usually we use the posterior leads for detecting posterior ST segment elevation MI. Okay, this is really very helpful when the patient is presenting with a chest pain and the ECG showed like the anterior leads are showing ST segment depression and you are not sure if this is STEMI or non-STEMI, okay? So you place the leads V7, 8, and 9 on the posterior chest wall on the left side to detect any ST segment elevation, okay? For the posterior lead placement, we usually use the approach of V7, 8, and 9, in which we place V7 at the left posterior axillary line, at the axilla, okay, at the same level of the V6. All of these leads, the posterior leads, are at the level of the V6. Okay, we don't go down or up. It's at the level of V6. Okay, V8 will be just below the tip of the left scapula, and V9 will be on the left parasternal region. Okay, and you just run the EKG. Of course, you are putting the anterior leads as well, V1, 2, 3, 4, 5, 6, 7, 8, okay? Till 6, okay? And you add 7, 8, 9 on the posterior wall to have a comprehensive image or orientation on the heart to see where is the ST segment elevation is located. And that's it, and thank you.